Hey guys, it's Steven with CORE Therapy and Pilates. Today I wanted to go over a little Facebook Live video with something that I think is very important, and it's something that has been dear to my heart for some time. And I heard someone talking about this over the weekend and thought, oh, this is perfect. I got to get this information and message out. What I want to talk about is the role of the physical therapist in the medical system. Most people, when they hurt their backs or they hurt their shoulder, they have a headache, they go straight to the MD, who is considered the primary care physician. However, I feel like for musculoskeletal issues or anything on the outside, that the primary care provider should be the physical therapist, not the MD. And I'll go into more details about that in a moment. But when someone has a tooth issue or something with their teeth, they go see the dentist. When someone wants to see a doctor that specializes in the foot, they go to see the podiatrist. Come here, Dudley. You can't knock. Dudley's about to knock over the camera. Hang on, buddy. You just hang tight with me. Don't knock that camera over. When someone has an issue with their eyes, they go to the optometrist. But what happens when people go see the physician for back pain or neck pain, they end up getting provided with opiates and medicine to fight that. So that's my primary reason why I think a physical therapist should be the first and foremost place to start, because there will be no drugs provided. We are in an opiate epidemic here in America, and what happens when someone goes to see the doctor, the MD, for back pain or shoulder pain, and they're provided with an opiate, that is a problem, and that is happening at a tremendous level. I read an article just last night. I'm from Louisiana. I grew up just outside of New Orleans, and I read an article that said that in Louisiana right now, out of every 100 residents, there are 98 prescriptions for opiates. Chew on that. For every 100 residents in Louisiana, there are 98 prescriptions for opiates. That is crazy, and that wasn't even the highest in the country. They were 5th in the country. There were a few more states that were worse. So my point is if you go to a doctor and they give you medication because that's really all they know how to do to help your back pain, they're setting you up to be in a place of a possible opiate addiction, and that is not something we want to do. So with physical therapy, if you start with physical therapy, we're going to be doing natural things to help you that will not interfere and cause some kind of major problem like with the opiate epidemic that's going on. So again, primary care physician, the primary care provider for physical therapy for musculoskeletal injuries should be the physical therapist. However, it's not. So I think it's something that I want to just get out there and change, because what happens a lot of times, you go to the MD with back pain, they give you drugs, they send you to the orthopedist. The orthopedist won't see you until you get an MRI, so it's going to take about a month to get the MRI and get in to see the orthopedist. Well, in that time, typically the physical therapist can already make tremendous changes and really be helping the person get back to doing their goals of what they really want to do. So that's my message for today. When your back hurts, go to your physical therapist. When your shoulder hurts, when your knee hurts, go to your physical therapist. If you see a physical therapist first and you still need to see a doctor, they can send you there. You can always go get injections. You can always go get medications. You can always go get surgery later. But if you do it first, you might miss the chance to solve the problem conservatively. Okay, that's my message for today. Hope all is well. Like, comment, subscribe, and we'll see you around the studio. Take care.